This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dayal Singh, the Chief Medical Officer, Dr. Roshan Parasram, and Camille Campbell, Counseling Psychologist at the Northwest Regional Health Authority. The Minister of Health, the Honorable Terence Dayal Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you, Minister Cox. Good morning to the Chief Medical Officer, Dr. Parasram, and good morning to Ms. Camille Campbell. Thank you for coming back again. So, ladies and gentlemen, we are going to this morning disaggregate some figures of our last 14 cases of COVID-19 to show what could be an alarming trend if we don't manage the return of our nationals to Trinidad and Tobago. But it has to be contextualized once again in what is happening globally. And I always give these global figures to contextualize the fact that this is a global pandemic that is still raging. Today, the total count is 10,632,053. At this alarming rate of increase, last week we were talking about touching 10 million. Well, we have touched it. We have surpassed it. We'll be touching 11 million in short order. Deaths have crossed the 500,000 mark, 515,000. Now, what is happening internationally is this. The rate of increase in the numbers of positive cases keeps going up. It keeps averaging between 150,000 to 200,000 cases a day. It has shown no sustained decline. It averages. What is going down, luckily, is the number of deaths. So the number of deaths are now in the vicinity of about 5,000 deaths per day. At the peak, it was over 7.5, close to 8,000 deaths per day. So while deaths are coming down, the number of confirmed cases keeps on rising and rising. The number of people who are in absolute critical condition is still around 57,926 globally. That means they are in an ICU setting, HDU setting, and the outcome for these persons may not be very good. So we are in the middle of a global pandemic. What is disturbing with the new trend globally is that, and the CMO can come in on that, more and more younger persons, not the elderly, people in their 20s, their 30s, their 40s, the number in that age group between 20 and 40 is going up exponentially. And what is happening? They are suffering from things like strokes, cerebrovascular accidents, blood clotting, and we are noticing that now in a former healthy population. A lot of this is attributable worldwide to social activity of this age group, going out, partying, and so on. So we want to urge this cohort in Trinidad and Tobago that we are paying attention to the trends and we are bringing this information to you that you should take care of yourself and minimize your social contacts. What has happened with our last 14 cases from case 116, 117? We had brought in a family of 3 from Houston, Texas. You may remember 1 out of that family of 3 tested positive. So that tells you that as we bring in more and more people, we have to be on the lookout. On the cruise ship, there were roughly about 307 persons. We got initially 6 positive cases and then a further 3. So we got 9 out of 307 off the cruise ship, and those people are now on land, and the Chief Medical Officer will go through that with you in some detail. From the UE students from Barbados, we got 1 out of 46. And from the deportees from the United States, we got 3 out of 20. The point that should be made is that our last 14 cases have come from persons we have allowed to come back in. That means that as we manage the inflow of our citizens back into Trinidad and Tobago, it has to be a managed flow. And to prevent community spread and to prevent our health systems and economies from collapsing, these persons must be housed in state quarantine or under the management of the state if they are being held in a hotel or other facility that they are paying for. It is only because of these measures that we have adopted, which I could understand, especially the folks on the cruise ship. Look, these people did not ask to be there. All they were doing was doing their jobs. All they were doing was earning an honest living, working on cruise ships. No one asked for this. But we have found ourselves in this situation, and whilst we understand and sympathize and empathize with them, the measures we have put in place, we just ask them to hold on a few more days, and the CMO will speak to that. We understand their frustration. This virus came and met them whilst they were doing their jobs, like everybody else around the world. So in just analyzing these last 14 positive cases, there are 2 messages. One, we must continue to strategically manage with the Minister of National Security the inflow of persons in a very strategic, careful way to protect the gains that we have made, to make sure we don't have to lock down the economy again, put people out of jobs, have businesses closed. We are protecting the economy. And by having them in state-managed quarantine, we are protecting the health of 1.4 million citizens. And that is the way we will keep on with our curve being as flat as it is. So that 2 things could happen. One, the regular health system, which has gone unnoticed, is working fine. And that is a major, major achievement for a country like ours. Other countries don't have that luxury. And 2, to make sure that we have all the capacity in case we have a flare-up of cases, in case in the unlikely event we get community spread. So before I close, I just want to again welcome Camille Campbell, a counseling psychologist. I got a lot of positive response from her last presentation. Lots of parents contacted me and said how grateful they were for her presentation. I am hoping today that as we focus on SEA, we take the opportunity to really help those parents and help those students and really interrogate that part of our COVID response. So, Minister Cox, I thank you for the last few minutes, and back over to you.
Thank you very much, Minister. The Chief Medical Officer, Dr. Roshan Paraswaram, will provide us with a clinical update.
Thank you, Minister Cox. Good morning, Honorable Ministers, Ms. Campbell, members of the media, members of the viewing and listening public. The clinical update for today, Wednesday, the 1st of July 2020, is as follows. The total number of tests done thus far, 5,089. Total number of unique patients tests, 3,996. Number of repeated tests, 1,093. Total number of community tests thus far, 1,840. Total number of positives are now increased as of yesterday to 130, with our last 4 cases coming within the last 24 hours. Total number of discharges have gone up to 115. The first 6 cruise ship passengers that were positive are now discharged from the Cora Hospital. Total number of deaths remain at 8. And total number of hospitalized patients are 7, with the addition of the 4 from yesterday. So 7 in total at the Cora facility. Looking at the parallel system, we're looking at quarantine individuals at 551, and that is split between the following facilities. So we have Cora Hospital having 24 individuals, Couva Medical and Multi-Training Facility with 142 persons. The UE Debe Penal Campus now has 42 individuals. At the Chancellor Hotel, there are 19. At the Tacarigua Racket Center, there are 40 individuals. Napa, where our healthcare workers are housed, there are 6 persons. At the Sandy Grande Brooklyn facility, there are 32 persons. At the Balandre facility, there are 42. UE Freedom Hall remain with 45 individuals. At the Cape Park Hotel, we have 48. Cascadia, 2. Merce Developer Rig has 94 persons on it, and the Vision on a Mission Claxon Bay now has 15 individuals with the removal of 3 persons to the Cora facility. Just to touch on, last time I would have indicated that we were trying to designate facilities to do community testing. So later today we will have a press release going out stating which facilities, but I'll give you a little breakdown of where we're going to have those designated facilities. So as of today, the following facilities have been designated for COVID-19 community testing. These are the St. James Health Center within the St. George West District, El Socorro Health Center within the County of St. George Central, the St. Joseph Enhanced Health Center at the St. George East County, Shoguana's Accident and Emergency at County Caroni, Mayaro District Health Facility in Nariva Mayaro. In St. Patrick County, the facility will be Siparia Health Center. In St. Andrew, St. David, we're looking at Sandy Grande Enhanced Health Center. And at Victoria, we're looking at Pleasantville. So the following clinical criteria will be utilized. Basically, persons presenting to those facilities anytime between 8 and 4 p.m. with any of the following symptoms will be eligible for testing. So anyone with a fever, cough, rhinorrhea, which is runny nose, headaches, redness of the eyes, loss of taste, or loss of smell. Swabbing will not be considered at these centers for asymptomatic persons, meaning having no symptoms, as follows. A, for pre-delivery screening, for pre-surgical screening, or for screening prior to repatriation. So people can contact the offices of the CMOHs throughout the country for further details, and of course we will send out a press release later on today with all the information that I just gave out. Minister Cox has my clinical update for this morning.
Thank you very much. Camille Campbell, counseling psychologist at the Northwest Regional Health Authority, will speak on coping mechanisms for students preparing for SCA and CAPE examinations.
Thank you, Minister Cox. Minister Cox, Minister Dial Singh, CMO Dr. Parasram, members of the media, and the wider viewing public, good morning. I am very grateful for the opportunity to share today on the upcoming examinations. I will first like to discuss the SCA exam so that we can put things in perspective. The SCA exam is a promotional exam that moves students from primary into secondary school. Parents, I get your anxiety. I understand your stress. I too have walked this road, just last year actually. I understand the societal pressure for your child to do well. Everyone, including family members and strangers, will want to know what school did your child pass for. The examination date is set for August 20th, 2020. I can imagine how some of you are feeling. Some may feel panic, worried, or fear may have gripped you. Yes, I get it. This examination can be stressful. However, parents, if your anxieties are not managed properly, they will be passed on to your child. Let's be careful what we say to our children during this time. All exams come with a level of stress and anxiety. But when this is compounded by what others say, it can have damaging effects. Parents, this exam will come and go, but your words will remain. It is the lowest level of schooling that your child will go through in their lifetime. How you manage this will set the pace and tone for how your child will respond to other examinations. Let your children hear, or your child hear, encouraging words, words that build. Use words that build their character. Even though your child may have been getting schoolwork during the COVID period, they will now be in a routine come July 20th in preparation for the exam. This is a change, so pay attention to them. Look to see if they are extra tired, feeling cranky, or unwilling to do work. Your response to these emotions will either break the child or build them. You may also see their grades fluctuate as they reintegrate back into a routine. Be patient with them. Look for things that you can praise your child for, whether it is grit, their willingness to work, getting up early when you woke them up to say it's time to move. Little things, just look for things to praise them for. There is a perception that some schools perform better than others. However, parents, whatever school your child is placed in will require the partnership of parents, teachers, and your child. Sometimes we may fear our child going to a particular school, only to realize after that was the exact place for your child to flourish. Any school that your child is placed in, I encourage you to get involved. Join the PTA. Be active in the school. Get to know your child's friends and their parents. Be present, be visible, and have a voice. Parents, have realistic expectations for your child. Each child is different. Don't compare your child to another. Your child may or may not be where you would like them to be at this time. Know that each child develops at their own pace. Some children will grasp the concepts being taught easily, while others may struggle. I encourage you to get to know the child God has given you. Some children may need additional tutoring in areas they are struggling with. Pay attention to your child. Some children may be struggling due to having a learning disability. And if this is not discovered, the child may be labeled lazy or not trying hard enough. Children will blossom with much love and encouragement. I remember a parent telling me that her daughter she went through 7 years of primary school, 5 years of secondary school, and she struggled, only to realize that the child had dyslexia and she just needed additional support to achieve. So I want to tell you, parents, children will blossom with much love and encouragement. Your child has worked hard. They have been preparing for this exam for quite some time. They would have endured tireless assignments and extra lessons. So be their #1 supporter. Parents, on the day of the examination, make sure your child has a proper meal, what the child has been accustomed to eating. You don't want to introduce new foods at this time. Don't stand around by the school waiting to see what is happening. Take some time for yourself. Everything will be okay. And when you come to pick up your child at the end of the exam, don't interrogate the child. At that point, the examination is over. What you can do is to let them know how proud you are, what you have seen, and how much you enjoy seeing them grow and develop, and even their level of maturity. Celebrate with your child. On the day of results, yes, it can be a very emotional day, but manage your emotions. Your child will remember how you respond. I remember listening to a radio program sometime, and there was a parent who, when she heard what school the child was placed in, she remarked, "That's the school you passed for?" Parents, the children don't choose the schools that they pass for. They do their part. So on the day of the results, be proud of your child, whatever and whether they got into their school of choice or not. Remind yourself and your child that there is life after SEA. To my teenage friends who are preparing for CSEC and CAPE, in the next couple of days, as exams are due to start shortly, ensure that you eat properly. Your body needs the right nutrients to function well. Studying on an empty stomach can leave you feeling drained and tired. So eat foods that will fuel your body. Also, ensure that you get enough rest, because you want to ensure that when you have a good night's sleep, it helps improve your memory. So ensure that you get a good night rest. Speak positive words to yourself, such as, "I can do this. I am going to try my best." You can write these mantras down so that you can see these quotes and keep reminding yourself that an exam tests your knowledge on a particular topic. So if you don't get it the first time, keep trying. In my last briefing, I spoke about deep breathing. Today, I want to add to that technique. When you are feeling overwhelmed or anxious, you can shift your thoughts to something that you like, which reduces stress and tension. It involves using your imagination to create pictures in your mind that will help you feel calm and relaxed. As you do your deep breathing, imagine that you're at a place where you feel totally comfortable and happy. This might be a favorite place or a special memory. As you focus on that image, know that you could return to this place of calm at any time and at any place. To those students who have a clear direction in where they want to go, that's awesome. Work hard and achieve your goals. To those whose path is unclear, whatever your hands find to do, do it well. There will be those who may start on one path as a career and find yourselves on another path. Knowledge is never wasted. Keep peeling the onion rings of your life until you find your passion. Some students are gifted with their hands. Use your God-given talents and gifts to elevate yourself. There are many programs being offered that one can become certified in an area when it comes to trade. I remember a teacher giving me a story that he saw a student many years later. He didn't remember the student, and the student came up to him and said how grateful he was that he taught him to do technical drawing. He said, "Sir, I did not leave school with any passes, but because of your class, I am able to read plans, and today I am a contractor." So I want to leave you today knowing that your life has meaning. Have a vision for yourself and for your life. Write it down. Make it plain. And remember that for every door that is closed, another one will be open. I thank you for the opportunity, and I now hand you back over to Minister Cox.
Thank you very much. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 98.1.
Once again, Stephen Cummings, 98.1 FM. I have 2 questions, one for the Chief Medical Officer and the other for Minister of Health, Minister Dayal Singh. I want to just, go first with the CMO. CMO, there is a report that some health centers across the country, regarded as being in crime hotspot areas, have been ordered closed due to sporadic and sometimes planned protests by community members. Can you confirm whether some health centers have in fact been ordered temporary closure? And Minister Dayal Singh, while this may be a question for national security, it is also impacting on the health sector. We are witnessing some very ugly scenes with violent protests and clashes in some communities with blatant breaches of the public health regulations. For example, crowds in excess of 25. Does this bring some measure of added concern for, to you for community spread of the COVID-19 virus?
Sure.
Thank you.
Thank you, Mr. Cummins. So, I checked in twice this morning with the CEO of Northwest Regional Health Authority because that is the geographic area we are most concerned about as far as health centers being closed. And I'm happy to report that all health centers and all health facilities from Caranage to Mova are in fact opened. The staffing level is a bit low, as you would expect. Additional security has been put in place because I spoke to her twice this morning. So no health center under Northwest Regional Health Authority is closed. I have had no reports of any other health center being closed for the reasons you indicated. I do know earlier in the week there was one health center that may have been closed due to maintenance problems, but that has nothing to do with the activities of yesterday. Second part of your question, there's always concern when people congregate in large numbers. So yes, it's an area of concern, but I'm happy to see that as of yesterday afternoon, after the crowds were dispersed, we didn't have much of a problem as far as spread is concerned with community spread. What is more crucial is spread in areas where people are jam-packed together indoors, like bars. That is much more dangerous than being outside. And I did use the analogy on Monday about beaches and bars. So outdoors, your chances of contracting COVID or any other viral infection, and the CMO can back me up here, is less than in a packed, crowded indoor facility. So I hope that answers both of your questions, Mr. Cummins, and thank you very much.
Thank you. TV6.
Good morning, everyone.
Good morning.
Morning.
Good morning, everyone. Elizabeth Williams, TV6 News.
Good morning.
My 2 questions. Since this one is for the Minister of Health. Since there are no COVID-19 cases in Tobago, is the Ministry of Health looking at housing COVID-19 patients in Tobago to allow more people who wish to be exempted to come home? I don't know if this is something the ministry is looking at. And also, I don't know if you can help me with this. I know Minister Donna Cox, if there's anything, she would relay the information. Student athletes who are required to return to universities abroad, what is the specific path that they should follow in terms of being able to journey to their various universities abroad?
Okay, thank you, Elizabeth. So I'll take the first question. Whilst there are no COVID-19 patients in Tobago, the issue of moving patients from Trinidad and Tobago, the actual physical movement, whether it's by air or by sea, will then pose challenges and then increase the possibility of spread. So we would like Tobago to continue to house and quarantine people who come straight into Tobago, which they have done successfully in the past. Whenever you add another logistical step to any operation like this, you increase risk. CMO, you agree with that? Yeah. So it's not something that we are actively considering. I mean, if we are in dire straits, it is something that may be considered, but right now it is not an option that we are considering. Thank you for the question.
Minister, I don't know if the CMO concerning athletes to travel.
No, it's not athletes, it's returning students.
Returning students.
No, I mean, I think you're asking about the process if persons want to return out of the country, and I think the process is really to apply to the Minister of National Security for an exemption in the first instance to leave the country. So I think that's basically the process. Once you get that exemption, and of course there are flights available, then you can leave. But it has to be an application to the Minister of National Security.
Okay. AZP News?
Hi, good morning, Prior Bihari, AZP News, 3 CMO. Sir, can you explain how it is the people who are boarded cruise ship, the ones that were tested positive, have gone home earlier than the ones who have never been tested positive, who are always negative? Just that issue. I want to explain. Thank you.
Okay. All right. So when someone tests or shows symptoms and tests positive, they follow a different pathway from the other group of people who are in quarantine. So the normal quarantine period is 14 days. Those people, in the first instance, the 6 persons that tested positive would have tested positive on the second day of their quarantine, which was day 2. They would have been brought into hospital. Our procedure thereafter is to have 2 consecutive negatives 24 hours apart, right? But it has to be at least 7 days after having no symptoms. So they would have gone through their 7 days of no symptoms, had a first test which was negative, and then subsequently some of them actually had positive tests thereafter. But now that they have all had 2 consecutive negative tests 24 hours apart, they were allowed, the last 2 persons out of these first 6 were allowed home yesterday, which was slightly, the last 2 were slightly after the 14-day period, but the first 4 went home just before the 14-day period. So the 14-day period doesn't have anything to do with persons that are becoming positive. Another protocol kicks in once you become positive, and once you meet those clinical criteria, you can be discharged. So we're not looking at time in the same way as quarantine when you become positive.
And let me just come in here, because it's a very good question that Prior asked. It is not that we invented that protocol for the cruise ship passengers. That protocol was in place from day 1, and we applied it to the Balandra group.
Correct, yeah.
That came in from Guadeloupe. So I don't want the cruise ship folks to feel they are being unduly punished. It is the exact same protocol we used way back in March, was it?
Yes, yeah.
When we had the 62 or 68 odd persons coming in from the cruise ship from Guadeloupe. Exact same protocol being applied now.
And just to add, in terms of the Barbados national, the Trinidadian national that was in Barbados as a student, we would have gotten a positive late into the quarantine period on day 13 actually, or 14. And now the entire group of them, 45 of them, have to stay at an additional period of time and be retested because of that late positive in that facility. So the same thing applies to them as well.
Okay, thank you. Guardian Media Limited.
Hi, morning everyone. Rishard Khan, Guardian Media Limited. You all hearing me?
Yes,
Good
loud
morning,
and clear.
yes.
Morning.
Okay, great. 2 questions to both the CMO or the Minister of Health, whichever one of you all want to take it. My first one is, what is being done differently at the Balandra facility? Because if you remember, and I know you all spoke about it just now, a large number of persons who were housed there in the first batch of cruise ship passengers that came tested positive, and they were in communal spaces. And a person who is quarantined there reached out to me and said that they are sleeping in a room with 6 other persons, and the concerns are growing of contracting the virus. And my second question is, so far, the normal flu virus that we have, the seasonal virus, has killed more people locally than the COVID-19. So going forward, is there any way, or could we expect to see some of the same protocols which we have adopted and enhanced to deal with this pandemic be applied for treating with that normal virus? And I'm speaking more to the quarantining and testing and that kind of stuff.
Okay, so I will take the second part first. So the big difference between H1N1 and COVID is that there's a vaccine for H1N1. If the susceptible populations heed the call to get vaccinated, we could have avoided the major part of those 41. I'm seeing that people are not hearing. I'm seeing prior and them saying, are you hearing me? No, not hearing. So we have a technical glitch.
Okay, we have a technical glitch. I think.
Are you hearing me now? No? Hearing? Rishard?
Rishard is hearing.
Yeah? Good.
Okay,
Right.
good.
Yeah. So going back, the major difference between H1N1 and COVID is that there's a vaccine for H1N1. So most of those 41 deaths could have been avoided if those persons, susceptible persons, got vaccinated. I think I can speak without fear of contradiction. When we did the retrospective analysis, none of those 41 people were in fact vaccinated. CMO? Could you remember?
There were a few patients that we did not have that information.
Yeah. So most of them were not vaccinated and some we did not have the vaccination. So that's a major difference. Preparing for this year's flu season, and I'm glad you brought that up, Rishard. It's a very good issue to raise. Preparing for this year's flu season, we will not shut down the country for seasonal flu, for influenza. However, if we continue and build into our culture the public health measures, simple ones like the hand washing, the sanitizer, wearing of mask, the social distancing, stay home if you're sick, we can significantly reduce the number of deaths with vaccination, the number of cases without shutting down the country. So those are the two major differences between H1N1 and COVID, and I would like these public health measures to be institutionalized in our places of work, our places of business, and become part of our new culture, our new normal.
Yeah.
CMO?
All right, so in terms of the Balandra facility, as you would recall, we had a meeting with the cruise industry on Sunday to determine the way forward. So our proposal was initially that we continue the quarantine on the vessel until we actually going to reswab on Friday morning. Logistically, it could not take place. They had to leave the waters yesterday, which they did, and we had to bring those people off board. So what we did is there's a stratified approach that they had been taking from day one. As you know, all those individuals on the ship didn't come from one particular vessel. So that vessel, Enchantment of the Seas, was designated as a quarantine vessel, being free of passengers for quite a long period of time and well sanitized to house them individually. So that was done, but they were put into different zones. So they were put into orange zone, yellow zone, green zone, in decreasing order of potential risk of disease based on the vessels that they came from before having positive cases on it. The persons that would have tested positive, to the most part, would have been from yellow zone and orange zone, I believe. So when we stratified the way we're going to take them off the vessel and put them into our quarantine facilities on land, we put the higher risk individuals. Not that the entire group is very low risk now, because they have spent quite a long time on the vessel. They have been tested twice. But of the low risk people, they are very low risk and they are low risk. So the low risk ones would have been put into the Cora facility as well as the Kuva hospital. So those would have been a slightly higher risk. The other individuals would have been put into the other facilities, which is Balandra, Sandy Grande, Tacarigua. It is really just a holding bay for the next 3 days, actually 2 days now. We're going to test them on Friday morning and hopefully have results by Saturday, if not early Sunday morning, and try to discharge everyone on Sunday. So about 6 persons being in one room, I don't think that should be the case. If you recall, with Balandra, we had originally 68 individuals in there. Now we are housing 40, so we actually decreased the capacity. We could take more, but we decreased the capacity so that they will have little interaction in that regard. So I'll have to check on that with my team in St. Andrews and David to verify if that is happening. Of course, if it's happening, that shouldn't be the case, and we will fix that. But basically, that's the way we stratify them. We expect that they are very, very low risk. We have staff with them, ensuring that they wear their masks, they sanitize, they stay to themselves for the next 2 days until we can test. Okay.
Newsday. Newsday.
Good morning.
All right.
Hi, good morning.
Good morning. Well, we're not hearing you clearly.
Hi, good morning. No?
No, we cannot hear Newsday. Could we move to someone else and then we'll go back to Newsday, please? So we'll take TTT at this time and then we'll go back to Newsday.
Khrystal Wilson here from TTT. In the absence of the Social Development Minister, and perhaps this concern can be forwarded to her or answered by the CMO. We've received concerns from members of the public. They're asking what are the arrangements in place for persons in receipt of the Senior Citizens Grant who are required to visit the Social Welfare Office. I believe it's once a year at around their birthday, to sign a document with the COVID-19 regulations in place and them being susceptible to the virus. They're asking what, if anything, has changed with them having to visit the office to sign the document.
Okay, I could answer that. Actually, that was extended. We spoke about the ID cards. So senior citizens, you do not have to go into the office. It has been extended to the end of the year. We go back to Newsday at this time.
Good morning. Good morning, are you hearing me?
Good morning. Are you hearing us?
Yes, I'm hearing you. Are you hearing me?
No, we are not hearing you clearly at all. Okay, what we'll do in the meantime, I have a question from online to the CMO. They're saying that some stores have employees wearing face shields and not face masks. Is this acceptable?
Yeah.
And if so, is it also acceptable in like houses of worship, malls, cinemas, and so on, the face mask?
Yes, so it is acceptable alternative in certain circumstances where persons cannot wear a face mask. For instance, if you have chronic obstructive lung disease, asthma, or you find it difficult. For instance, I saw some gyms when they were doing the protocols, they actually have persons using the face mask, which is a very good alternative. The face shield needs to come below the level of your chin and extend beyond the level, beyond your eyes on both sides. Be of a material that can be easily cleaned. So that's the important part of it. But they can be a suitable alternative. The only person we would not want to wear a face shield as an alternative is if someone is ill and has active symptoms. So those individuals should be wearing a face mask.
Okay, thank you. There's another question. Are teachers allowed to have face-to-face staff meetings, as the health minister has said, to avoid gatherings as much as possible? There's a concerned teacher.
Oh, yeah, so I mean, of course, gatherings, we follow the guidelines as much as we can. We keep it as far as possible to virtual forum. But again, once you have congregation, you need to abide by the guidelines, the public health regulations in terms of the spacing, hand washing, etc.
Okay, are we ready for Newsday? If not, I'm seeing TV6 hands up, so if Newsday is not ready, then we would take a question from TV6.
Hi, good morning again. Elizabeth Williams, TV6 News.
Good morning.
Just two quick questions.
One question, please, Elizabeth.
Okay. In terms of the SEA exam, and parents being really worried about their children and de-stressing, I know Ms. Campbell would have spoken about deep breathing and also shifting your thoughts. What else can be done for parents who are stressed out over the SEA exam?
Ms. Campbell?
I think we need to put the exam in context. Now, this is a natural feeling. Each parent goes through it. So in addition to the breathing techniques and the, well, it's actually called imagery and how to think about using your thoughts, you could probably try having some social support. Meet with other parents who may be identifying how you are feeling. So instead of putting that anxiety on your child, parents can come together with another parent and provide that type of support during this time. Some people even use spirituality to aid them in that way as well. So there are different ways that parents can alleviate their stress. But all in all, I think it is important to ensure that those feelings and your own stress does not pass on to your child.
Ms. Campbell, what about the balance between study and play?
Oh, that's very important. Thanks, Minister. I know that during this time, a lot of parents may feel that studying more is what is needed at this time. But it is important for children to have that balance of play. It not only changes their mind from focusing and sitting in the same position all the time, it helps stimulate them so they can do something that they like. And, we encourage children, yes, play at this era, yes, plays video games, we get that. But sometimes just doing other things could just rejuvenate you, remove your stress, and then come back to doing some stuff again. Because I remember when my daughter wrote SEA, we were told, is books and ensure that you're doing a lot of the assignments and things like that. And the thing is, when she came home, we found time to play. We ensured she had enough time to detox, to enjoy stuff, to have a good meal, maybe even to watch a little television, because balance is so important at this time. So parents, you are responsible for creating that balance. Don't just have the child doing schoolwork. After a while, they'll become frustrated, burnt out. So you want to ensure that they have that balance of rest, proper eating, sleep, and play.
Thank you very much. Liz, before we move off from you, I came prepared, knowing that you normally will ask about the income and food support grants from Tobago. So I have the information for you, although you didn't ask. Total applications received for income and food support from Tobago, 2,884, and the total approved so far, 2,604. So I know you'll be very happy to hear this. I go back to Guardian Media Limited. One question, please.
Yes, hi. I will stick to that one question. My question is, well, I'll put it to you all, but I don't believe it's something that you all may have the answer readily available for, and I would appreciate if you all could find that out for me and probably let us know on the next occasion. I just want to know, since we are speaking about the new normal, and we've seen the guidelines and the Prime Minister himself speaking about letting persons work from home where possible. So I wanted to know if you all have figures or any sort of data available to let us know how many persons were working from home during the pandemic and how many now are being afforded that facility to work from home now going forward. And also within that, to find out if you all have any plans to really change the way we work and let this work from home become the new normal.
So, Rishard, you are asking very deep, profound questions this morning. The short answer is no, we don't have any data on it. But I could tell you from my experience in talking to some people, especially at the professional level and some private companies, one or two companies that frowned upon working at home in the past and said it couldn't work were quite amazed and shocked as to how productive their people were working from home. And that's a good thing because it can lead to some culture change. Because as I said, many companies frowned upon it in the past, and now we are seeing the advantages. But if you read the literature on working at home, there are some jobs that you simply can't do at home. So companies will have to look at it and see which jobs can do that, find a nice balance between work at home and coming to the office, because there are some things you need face-to-face interaction for. But it's a good way to change culture, but I have no figures.
Okay, thank you. We have a question from Newsday because we seem to be having some technical difficulties. And Paula, I think is her name?
Yes.
She sent her question.
Oh, lovely.
And this is from Ms. Campbell. Do you have any extra tips for helping students who might be living in areas where protests took place yesterday? Ms. Campbell.
Good.
Yes. Now, for children who may have been, a part of experience what took place yesterday, it could be unnerving. It could be very stressful. And I empathize with you. When it comes to living in these areas, we have seen where persons use education to get them out. So we would have spoken about using different techniques to help relax and going even to school. I know some children may be a bit afraid to even leave their homes and things like that.
Okay.
I want to encourage you. There are systems in place that you can go to get additional support. If you feel overwhelmed to the point that you can't function, there is the student support services. There is the child guidance clinic that you can go and you can get information on. You as a person understand what you have control over. So that if you feel that stressed or that overwhelmed, find someone who you can talk to and know that there are additional services in place that you can get further information from.
Okay.
Okay, thank you. I have another question because Newsday was entitled to 2 questions. So this is the other question Newsday sent. And this is for the minister. It's a bit long, so I'll read. The finance minister said on Saturday that contracts have been awarded to small stitchers through NIPDEP for the manufacture of 465,000 cloth face masks. The masks would be given to various NGOs, including Field, to distribute to the population free of charge. However, the tender was put out on April 14th. Would you say this long lag has contributed to people walking around without masks as they are waiting on those from the government? How do you and the CMO feel about the level of mask wearing in Trinidad and Tobago? This question is from Newsday.
Thank you. So, Paula, you see how the technology worked, Rishard? The technology is working. Okay, so Paula, I'll answer your question. I don't think that the lag in the awarding of the contracts has much to do with the low level of mask wearing, because I had concrete experience, as I said at an earlier press conference, walking in the Kwesi in Sawa, Independence Square, and people have masks. And when you walk up to them and ask them, well, why are you not wearing the mask? You get all sorts of reasons. So I don't think that people not wearing masks has to do with the lag. I think people are just not getting the message. One, there's a level of complacency in this society because we don't have community spread. We have done such a good job in managing our cases in that they are all imported. So people are letting their guards down. Am I comfortable with the level of mask wearing? I will speak to myself and then the CMO will speak. I'm not going to put him on the spot. The answer is no. I would like to see many more people wearing masks, especially in critical areas like public transport. If Caribbean Airlines can get 100% compliance with mask wearing, because if you don't have a mask, you can't board a flight, I would like to see that same type of energy being brought to other areas of public transport. If West Mall, which I visited, and other malls, have a policy when you walk in, you must sanitize and have a mask, and it works, I would like to see it done. If the fast food outlets say no mask, no service, and it works, so it's not a matter of the government not wearing masks, Paula. It's a matter of industry and all the opinion leaders leading their industry in wearing masks. The doubles vendors, and I will say it again, you will get fed up of me saying it. The doubles vendors are my heroes because every single doubles vendor is wearing a mask. If they can do it, so can the rest of us. So I am not happy, but it's not due to the fact that the government hasn't been making masks. CMO, are you happy with the level of mask wearing?
I think in certain instances, yes. For instance, in the restaurants, there are a lot of people that are saying no mask, no service. Even at gas stations, I am seeing it happening when you go to the window to pay. If you don't have a mask, you're not allowed to even pay to get gas. So in the open spaces, people are not wearing masks as they should. I think there's, but again, we have to, where there may be social distance taking place, there's a allowance for social distancing. The need for mask wearing diminishes somewhat. So in the closer instances, as Minister suggested, on transport, for instance, when you're coming in a maxi or a taxi, that close contact areas that we should be wearing a mask to prevent any sort of spread. So those are the critical areas that we have to focus on. But we are doing a fair job generally in the way that masks are being worn in the population.
Thank you. We are almost out of time, so we will take one question from 91.9, please.
Hi, good morning. Thank you very much.
Morning, Vern.
I just have I just have one concern. A teacher asked me to ask about SCA students. Are they being allowed to attend private classes at private institutions or classes at schools prior to July 20th? Just to get some clarity for some teachers who don't understand about being able to provide SCA support before July 20th. That's my only question this morning. Thanks.
Yeah, so I mean, the exemption we had given, not exemption, but exemption to the norm was really to facilitate examination type work. So relating to exams, of course, you have to make sure that your space can accommodate persons maintaining the social distance, etc. But, and again, having something in your private home may not fall within the regulation strictly. So we don't want to be extremely prescriptive as it relates to it as saying yes or no. But again, you have to look at your space, see how many people you can hold, and determine what public health measures you can put in place to ensure the safety of everyone.
Okay, thank you. We have come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. 4 additional returning nationals tested positive for COVID-19. All cases are imported, and the Ministry of Health is implementing established protocols. As such, there is no risk of local transmission to Trinidad and Tobago, but it is a reminder that COVID-19 is still at our doorsteps. It is also a reminder that we need to be patient and trust the systems put in place by our public health officials. We know many of you who return to Trinidad and Tobago are anxious to get home to your families, and quarantine probably feels like a difficult pill to swallow after being away from your homes and loved ones for so long. We know that you want to see your family and friends. We understand that you would like to be in your familiar surroundings, but we are asking you to hold strain a little while longer to protect us and your loved ones. We must ensure there is no worrisome change in our numbers. It is the only way out of this, alive and healthy. And for those adjusting to our new normal as the country reopens, I wish to remind you to wear a mask at all times. No mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.